How do you track cervical mucus consistency to predict ovulation? Cervical mucus is the fluid produced by the cervix or the lower part of the uterus. It's the discharge that you see out your vagina. Changing hormone levels in a woman's body result in a change in the color and consistency of the cervical mucus throughout your menstrual cycle. On the least fertile days of the cycle, the cervical mucus is thick and dry. This thick mucus makes it more difficult for the sperm to travel up the uterus to meet the egg. The most fertile days of your cycle are known as your fertile window. This is a 5 to 7 day interval starting about 5 days before ovulation, the day of ovulation, and 1 day after ovulation. About 4 to 5 days before ovulation, the cervical mucus becomes thin and slippery and assumes a sort of raw egg white-like consistency. This thin and slippery mucus allows for the sperm to effectively swim up the uterus and to meet and fertilize the egg. So for example, in a woman with a regular 28-day cycle, the cervical mucus will be raw egg white-like from days 10 to 14. Focusing unprotected sexual intercourse during these days will maximize your chances of getting pregnant. The color and consistency of cervical mucus can be observed on a piece of toilet paper or underwear, but the best way to do this is to roll and pull the cervical mucus between your thumb and index finger after thoroughly washing and drying your hands. For women with fairly regular menstrual cycles, tracking the consistency of your cervical mucus over the course of a few months should allow you to predict your fertile window with reasonable accuracy.